So I'm a doctor based in Australia, but I've lived half my life in Canada. And I've been getting a lot of questions on if I'm going to be going back to Canada anytime soon. And the simple answer is no. I love working as a doctor in Australia, and I love the country as well. But I think if we look at the medical side of things, after I've spoken and seen a bit of the Canadian healthcare system, as well as the American healthcare system, I feel extremely fortunate and grateful to be working as a doctor in Australia. I think our working conditions are much friendlier and much better if we compare it to Canada and the States. We don't have to pull as many strenuous hours in comparison to the other two countries. I think we're more protected as employees, where stress, fatigue management is done in a comparatively better manner, although there is improvement to be made. I think our pay is better in comparison to the other countries, specifically speaking, during the training period, where we get, paid overtime for extra hours worked. And I also think having the private and public healthcare system lets you have more diversity for choosing, a specific career or dabbling in both sectors or one, where you don't really have that much flexibility, say in Canada, where the system is primarily public. So I think from a, career diversity point of view, just have a few more options in terms of what you'd like to practice in. So yeah, the simple answer to whether or not I'm going back to Canada is no.